Hey y'all, Kayla Mowdy, Doctor of Physical Therapy here with another Monday educational moment. Today I'm going to talk about headaches. So did you know that physical therapy can treat headaches? I'm going to go through the types of headaches and how we can help with those. Just a little education. There are migraine headaches, which are recurrent, usually severe, maybe genetic. They're usually one-sided, pulsating, intense, sensitivity to light, sound, those kinds of things. They can last anywhere from 2 to 72 hours. The second type of primary headache is a tension type headache. So these are tight feelings, like it's pressure being squeezed, a lot of times associated with stress, lack of sleep, muscle tightness, certain positions with work and jobs and stuff. And then cluster headaches, intense, brief. Sometimes they happen recurrently at the same time every day, sometimes in the middle of the night, intense, brief, in groupings that may last minutes to hours on that. Then there's secondary headaches, which cervicogenic is one of the names that is used. Usually one-sided and changes with head position. So like if you get headaches while you're on the computer and you get up and walk around and your headache goes away, that might be a cervicogenic headache. Or if you're doing a certain task on your phone or something, or if you get headaches after you drive a lot when you're looking left and right in traffic or things like that. So those are the four types of headaches that I see and can do something about. Most of the time, a person with chronic headaches has very tight muscles, front, back of their neck, even into the head. There's the temporalis muscle that's underneath the face. A lot of times there's jaw clenching involved that can benefit from education from PT. We can advise on sleep, like I've done in the past videos, stress management, muscle releases, manual therapy to the joints of the neck. There are a lot of vascular receptors in the neck that speak to the brain. They can help with that. I do want to speak to some medical related headaches that you would have to see a doctor for. If you're getting headaches with high blood pressure, that's something that needs to be addressed by medical. There's other sinister cases that if they're not responding to physical therapy, you may need screening for a tumor, vascular disorder, meningitis, those kinds of things. But the main thing that I treat, which is the most common type of headache, is this pain spasm cycle thing. You have pain, so you lock down and you don't move, and you get in these bad positions, and then you have more spasms and tightness and more pain. And a lot of people get into these cycles and just cannot break out of these cycles. They try a bunch of different medications. There are a lot of headache medicines out there over the counter. There's even some seizure drugs and things like that are used with some benefit for people with headaches. But I also think you should have physical therapy just to address the mechanical causes of this pain, and also teach you coping strategies. We have lots of stretches and breathing techniques and things that if you can master and manage, you can do better with your headaches and continue to function in society, even though you may have those occurring. I hope y'all have a wonderful Monday. I hope y'all learned something from this. Again, to review, migraine headaches, usually one-sided, intense, pulsating. Tension type headaches is the pressure, usually global. Cervicogenic can also be pressure, but it can tend to be one-sided. Something in the neck is not moving correctly, so everything else kind of just gets thrown off. Cluster headaches, intense, brief, but in groups and sometimes in the same cycle each day. Something to do with hormones and stuff. And then there are some sinister causes that would require some medical testing and medical treatment as well for your headaches. But just know you can see a physical therapist if you're having problems with recurrent headaches and they're interrupting your daily life. Have a good Monday.